There for Care is brought to you by CareScout with the goal of sharing real-life conversations about aging care. Views expressed on this program are the speaker's own. We don't provide medical, legal, tax, financial, or other professional advice. Always talk to your own professional advisors for advice tailored to your needs. Today's guest is Marlena Del Hierro, Director of Operational Growth at CareScout.
You certainly don't want to get to a point where you're burned out because then everyone's affected. Respite is a break. Think of it like that.
And why is this so important for caregivers?
Because if the caregiver is not supporting themselves, then how can they actually support the person they're caring for? Some of the very traditional things that you might find or hear about respite could be hiring an in-home caregiver for a few hours a week. You can go to assisted livings for a short period of time, a week or 2 weeks or a month. Say you want to go to Hawaii. There are those types of options.
For the caregivers who may be listening, where would you suggest they start?
There are resources out there. Whether you're asking for help or whether you're going to an organization and asking them, that will get you to the next step. Be curious and know that you're not alone.
Welcome to There for Care by CareScout, a podcast all about aging care, whether you're navigating it for yourself or a loved one. My name is Katie Boyles, and today we have with us Marlena Del Hierro, an aging care industry expert with over a decade of experience in senior living communities and research in the field of gerontology. Marlena is passionate about building a better future for older adults and those who take care of them. And today we are going to talk about an important aspect of caregiving that is often overlooked, respite care. We're going to learn what it is, the options that are available to you, and why this is so important. So with that, Marlena, thank you for joining us today.
Thank you for having me, Katie.
And I would love to get into your background. So you have an advanced degree in gerontology. What does that mean?
Thank you for asking. Many people do ask what gerontology is and the degree that comes with it as a gerontologist. I have a master's in gerontology, which is the study of aging. And as a gerontologist, I've been fortunate to work in a variety of fields, senior living. I've worked with families, many families, navigating options for senior living or just care options in general. And I've also done other things like research and worked on age-friendly initiatives throughout California. So there's a lot you can do with a master's in gerontology. So I'm just happy to be here and happy to have the opportunity to share or help someone who is a caregiver at home.
And what influenced your decision to get into this field?
I had a variety of different situations, I would say, occur throughout my life. I think the one thing is that I am very close to my family. I have many cousins and aunts and uncles. I have siblings. And I just always was taught that family is number one. So I had a close relationship with my grandmother. And as she was aging was, I think you're so lucky to be around somebody who is aging or wise. So I saw her as she was throughout all of her different age, not her entire aging, life, but to the last days of her life. And I think that just inspired me to go into this field. I always kind of had a close connection with older adults. And I was fortunate to find out there was opportunities in this field and that you can actually have a degree and advance this industry. So I would just say family really just kind of pushed me into this field.
And so family is a big part of it when someone is being taken care of. So the topic we have today is caregiver respite. What is that?
Yes. So respite is a break. I think of it like that. And it's not for any caregiver, it's probably not a new caregiver. And caregiving can be seen in a variety of different ways. And you might not even know you're a caregiver, to be frank. It doesn't mean that you're living or you're helping somebody with ADLs. It can mean something else where you're just trying to make sure mom and dad is getting to the doctor or is taking their medication or getting their medication. So it is a break. It is a break. But it is a industry term. So if you're looking at research, it does, or options or resources, respite is the term that is used industry wide.
And why is this so important for caregivers?
I mean, caregivers are so important in general, right? As a caregiver, it could be a physical strain on your body or mental, right? There's a lot of emotional burden that could happen or occur as a caregiver. So it's important that the caregiver is taking care of themselves and taking breaks. And breaks can mean a variety of different things, right? Respite can mean a variety of different things. So when you're looking at you can call like the ecosystem, and especially when you look at today's industry, there's a lot of focus on how can we support caregivers? Because if the caregiver is not supporting themselves, then how can they actually support the person they're caring for to their, fullest capable ability?
And you mentioned that there's many different kinds of respite care options out there for people to take, because I assume it's more than just taking a break when you leave your house with someone. What are the options available?
So again, when I think of respite, I think of a break, and I can see that in a variety of different forms. Some of the like very traditional things that you might find or hear about respite could be hiring an in-home caregiver for a few hours a week, right? A few days a week to help you go take that yoga class or be with your children or just take a nap, right? Like it's whatever you need for yourself. Other traditional forms could be, you can also caregiver ask for friends or family to help. It could be going to an adult day programming. There's centers where you can do the same thing, where you can have your loved one be surrounded by a community of people for a few hours a day. And then the last one as a traditional format I would say is assisted living or senior living. You can go to assisted livings for a short period of time, a week or 2 weeks or a month. Say you want to go to Hawaii. Like there are those types of options. But when I also think of respite, I can think of these innovative forms that might not pop into your mind as respite. It could be, meal service on demand. That's a break for you as a caregiver. Maybe you don't have time to cook a meal for your loved one. Transportation to medical appointments. Now there's several different resources, options, companies out there that have the capability of taking people to their appointments. The last thing, I want to bring up is like technology in the home. Like you might not think that this is a respite, but maybe it is. Maybe just setting up certain things in the home that help if there was a fall at home, if you're not in the house with your loved one. You could do cameras if with consent, but that also is an option, right? Like there's just ways to make you as a caregiver feel like you can just take a breath and just have a moment where like you don't need to worry and your mind isn't always your mind is taking a break, right? So that's how I would generally talk about respite and some of the formats and the options.
And if we're looking at this from the caregiver's perspective, what are some of the signs where you start to realize that maybe it's time I'm looking into this and I need a little extra help?
Yeah, I would say that many times caregivers, they're the champions, right? Like caregivers are the champions. So it's hard for it's almost too late, right? You don't want to get to a point where it's too late, which is why you're asking this question. I think immediately you should immediately when you're getting into a position where you're a caregiver, and I had mentioned this, earlier in the conversation, a lot of caregivers might not even know that they are caregivers, right? Just because you're not, providing physical support and care to someone doesn't mean that you're not a caregiver, right? Like again, you're managing a lot of different components, and as a caregiver, you should feel empowered to research and get help. And, you should start right away, right? Like when you're seeing signs that your, loved one is aging or might need a little support. I always say you should plan early. It's easier said than done, right? The conversation isn't easy, no matter how you look at it. Even if your loved one is, fully independent, like just having that early conversation around, hey, mom and dad, like, as you are aging, like what are your wishes? Like, have you done your advanced directives? Like all of that, starting that conversation early already is setting you up as a caregiver for yourself, right? You're already like planning for the future, and kind of getting things moving. So sooner than later is always like, what I preface this and tell and encourage families to do.
Mm-hmm. And for that person who is then looking to try to research what options are available to them or resources, where should they look?
Oh, there is so much. There's so many resources, content out there for caregivers. Obviously you can go online and you can, search general, like, I'm a new caregiver. What are some things that I should do? There are organizations specifically for respite care that you can ask, like, hey, what are some resources? What are some thoughts? What are some ideas? And not only, you can go online, or there are national organizations, area on aging, organizations that talk about respite care. There are webinars about respite care out there that you can access. There are local resources. There are respite grants out there, which like I'm always trying to advocate and share with people. There are respite grants. You can find a respite grant that will help you pay. It might not be, long term, but just for sure. Because again, respite sometimes can also be seen as a short term respite. Because there's, multiple ways that you look at respite. But there are respite grants where you can put that towards, if you are going to that trip somewhere, you can, or maybe you aren't, you can pay for an in-home caregiver, or you can put that towards a short-term stay. So, and also talk to friends, talk to family members. There are a lot of people, you're not alone. Like there are several caregivers all around you that if you just ask a friend for help too, like even asking for help is, again, might not be, might be harder or easier said than done. But asking a friend, they might know someone. Lastly, ask the physician, right? Like ask your loved one's doctor. They might also suggest a care manager, geriatric care manager, or somebody that is at another organization like the Alzheimer's Association. A lot of these caregiver organizations will have resources and can help you know and where to go to access them.
Mm-hmm. And it sounds a lot if somebody has not done this research before and say they're in an emergency situation, how would you suggest that they then approach that with the person that they're caring for if they're going to have to change the daily experience?
Like the conversation?
Yeah.
That's a good question. I think ultimately, it's seeing where that loved one is at, right? What's the type of emergency that occurred? A lot of times, maybe your loved one does not want to hear the advice from you, right? So I'm always like, talk to the president of the United States, which might be their doctor, right? Like, because everyone like, it's just seeing a separate, having a separate party could be very, very helpful as you are starting the conversation and as you're moving on to the next step. So it really depending on what's this emergency situation, or maybe there was a fall at home. Hopefully, if it were to escalate and you were, your loved one had a fall and was at the hospital, there are many people there that can actually start this conversation. There are case managers, social workers, again, depending on what occurred. But if you are having a difficult time having the conversation, you can start, it might, if there was an event that might help start that conversation, but lean on people, lean on those folks who have already been in the life of your loved one that can, maybe they trust, not to say they don't trust you, but, you have to really see where that loved one is mentally, right? Because it's hard for everyone. And again, I think kind of taking a moment and looking around, what are the other resources that you have as a caregiver that can help you navigate, what is the right the right fit, the right care, the right environment for your loved one.
So a theme in all of this is asking for help. For the caregivers who may be listening, where would you suggest they start? If this would be their first time looking at something, is there an ideal way to do it where you start with just a few hours to leave and then slowly build up to see how it works?
Mm-hmm. Yeah, I think it goes back to what do you need, right? If you start early, you might not need that much, right? You're not burned out yet. You certainly don't want to get to a point where you're burned out because then everyone's affected, right? Again, like if you are not taking care of yourself, how are you fully going to be able to take care of your loved one, right? And go into that environment situation with a rested body, mind, good attitude. So it really depends. So if you're starting earlier, you might not need as much care. You might be really just, needing support in meal preparation or little small like gadgets in the house that provide peace of mind for you around medication management, right? There's, again, I like to use the example of these small things that actually can relieve you of worry, which does affect burnout, which does affect your emotional health, right? So it really depends on who you are, which is they kind of like start early, right? Research, be an aging expert. Well, you actually I know you don't want to be, people don't want to be an aging, they might not think about being an aging expert, but caregivers are aging experts. They are aging experts. So you just naturally kind of get pushed into that as a role. But starting early is obviously is going to be my number one thing to suggest to caregivers is just really read content, listen to podcasts. And again, there's a lot of resources out there that you can access locally.
And the way that aging care is going nowadays, you see it all over in the media. More people are aging. A lot of the people who are taking care of their loved ones or maybe having to take care of them coming up soon are in this sandwich generation where they're taking care of their own kids. They're going to be taking care of their families. And I think that is we're going to see more of it often now. Where do you see the future of this space for respite?
Oh, wow. I love that. Where do I see the future? I think there is a lot happening right now, whether it's research. So, there is a lot of technology. There's a lot of products. There's a lot of conversations geared for the caregiver, right? So there's already a big focus on the caregiver. If you can make sure, and there's caregiver shortages, right? So even when you're in senior living communities, you have the burden of how do you make sure as a caregiver that you are giving all of yourself in that moment to your loved one? So there is already an industry push to make sure that we are building for the caregiver. That has been the angle, and research around caregiver burnout. I mean, even in this sandwich generation, there are studies out there that a caregiver who is is a sandwich generation who's caring for kids and is caring for a loved one is financially paying out of their pocket to caregive, right? How are we just bringing out this data and this research to caregivers to be aware of this, and to organizations, and to, in a political way, right? Politics. How can we put more into supporting our aging loved ones, our caregivers, because it all is even, right? It all should be an even importance. And how can you prioritize that, right? So I think there is absolutely just people who are interested in this space, like gerontologists who are advocating to say, hey, listen, how can we support our caregivers? How can we support people who want to live independent in their home, right? And putting light and attention to that is already bringing these research data topics out to light, right? To just then you have these startup companies, right? You have these new companies who learn around what is really a gap in the industry. Okay, let's figure out how to make things easier, efficient. Maybe you develop a product that has never been out there yet, right? A service that's never been out there. So, yeah, I mean, there's a lot of movement happening. There is an absolute lot of movement that's happening that hopefully will, that will just, caregiving is not going to go away. It's always going to be here. We're always caring for our loved ones. And again, awareness, conversations like this are so important so that people don't feel alone, so that people know like that there are resources and there's help out there. So I hope that we're doing a good thing by just having this conversation.
Yes. And for the caregivers who are listening, what are some of the most important things you want them to take away from this?
What are the most important things? I think mentioning that you might not know you're a caregiver and you are a caregiver. There are different types of caregivers, even if you're across the country. So to be aware of like what you're doing for your loved one is important and how that could impact your mental health. Number two is that it is important that you as a caregiver are taking care of yourself. And to give yourself some grace, right? Like this is a hard job and you're not going to do it perfectly and that's okay, right? But give yourself some grace. And I think the last thing is that there are resources out there. Whether you're asking for help or whether you're asking, going to an organization and asking them, that will get you to the next step. And and just again, like be curious and know that you're not alone.
Definitely. Well, thank you so much, Marlena, for going over all the different types of respite care that people can have and some of the places where they can find those resources to help.
Thank you for having me.
This is the There for Care podcast. Be sure to like and subscribe and stay tuned for our next episode.